Rescue breaths are artificial breaths given to someone who is not breathing. They are given by blowing air into the mouth to inflate the lungs. The air you breathe contains about 21% oxygen. Your exhaled air still contains between 16 and 17% oxygen. This exhaled oxygen is enough to support someone's life. To give rescue breaths, you need to make sure there is an open airway. The airway is the only path for getting air into the lungs. Someone who is unresponsive can lose muscle tone. If flat or on his or her back, the base of the tongue can relax and obstruct the airway. This is the most common cause of a blocked airway. The tongue is attached to the lower jaw. Lifting the jaw forward while keeping the mouth open pulls the tongue away from the back of the throat and opens the airway. You can open a person's airway by using the head tilt chin lift technique. Place one hand on the forehead. Place the fingertips of your other hand under the bony part of the chin. Apply firm, backward pressure on the forehead while lifting the chin upward. This will tilt the head back and move the jaw forward. Avoid pressing into the soft tissue of the chin with your fingers, as this can also obstruct the airway. Leave the mouth slightly open. As a trained provider, you should use a protective barrier such as a CPR mask or shield when giving rescue breaths to minimize your exposure to infectious disease. Before using a mask, quickly inspect it to make sure the one-way valve is in place. Place the mask flat on the person's face. Use your thumb and forefinger to provide uniform pressure around the top of the mask. Use the thumb of your hand lifting the chin to control the bottom. Tilt the head and lift the chin to open the airway. Lift the face up into the mask to create an airtight seal. Blow through the valve opening to deliver breaths. Each breath should be about 1 second in length and have only enough air to create a visible rise of the chest, but no more. Additional air is unnecessary. During CPR, 2 rescue breaths are given at a time. Provide these as quickly as you can, in less than 10 seconds. Take a regular breath before delivering the second rescue breath. If you remove your hands from the head, the airway will close again. It is necessary to open the airway each time you give rescue breaths. If you cannot get the chest to rise with a breath, reposition the head further back by using head tilt chin lift again, and try another breath. To give rescue breaths using an overlay shield, begin by placing the breathing port of the shield between the teeth and into the person's mouth. Tilt the head and lift the chin to open the airway. Seal the nose by pinching the nostrils closed over or under the shield. Take a normal breath. Open your mouth wide and press your mouth on the shield around the person's mouth to create an airtight seal. Blow through the port to deliver the breath. Each breath should be 1 second in length and have only enough air to create a visible rise of the chest, but no more. Take a fresh breath before delivering another rescue breath. The same technique can be used to provide mouth-to-mouth rescue breaths if you elect to not use a barrier device.